In this video, we are going to evaluate the membrane filtration technique and how we should use this technique to calculate the uh, number of bacteria per mil of sample. Okay, so membrane filtration technique utilizes a set with a filter base and a funnel. Okay, the filtration set should preferably be autoclavable. However, if you are not sure whether it's autoclavable or not, you can clean them with 70% alcohol and then rinse thoroughly with sterile water. Okay, the pore size used is either 0.45 micrometer or 0.2 micron. Okay, the membrane should be sterile. If you can purchase it sterile, pre-sterile, then it is good. If you cannot, then you have to autoclave it and then dry it before use. Membrane size is usually 47 millimeter in diameter, and once you have filtered your sample, you should place it on the media, suitable media, with or without an absorbent pad. Most of the standard methods recommend the use of a absorbent pad. This will allow better transfer of nutrients from the media to the bacteria on the membrane. Then of course invert the plates before incubation. So these are the sample volumes recommended by APHA, American Public Health Association, in their book Standard Methods for the Examination of Water and Wastewater. So these are the recommended volumes for total coliform, and these are the recommended volumes for fecal coliform. For research, you can probably adjust it according to your experience with the sample so that you are able to get a good count. So the calculation guidelines are as follows. So the best CFUs on the membrane are between 20 to 60. Okay, as most of the time we will use this to enumerate coliform and fecal coliform. For coliform, it is actually 20 to 80 because coliforms are usually in higher numbers than fecal coliform or E. coli. Then for fecal coliform and E. coli, we maintain 20 to 60 CFUs. However, the total number of CFUs on the membrane should be less than 200. Okay, calculate the number of CFU per 100 ml. Select the membrane to choose, and then the number of colonies on the membrane divided by the sample volume filtered, and you times 100. Okay, so if you have only one membrane that has the ideal range of 20 to 60, then you choose that membrane. If you have more than two membranes having the ideal range, you have to calculate to CFU per 100 ml for both of them and then take the average. If all the CFUs are below the ideal range, you have to report them as estimated count, okay, unless the sample size is 100 ml. If the sample size is 100 ml, then the CFU, even when the CFU is below the ideal range, you can report as true value and not as an estimate. So this is a special case, and this special case only stands for a sample size of 100 ml. If there are no CFUs in all the membranes, you take the largest sample volume and then you report as less than 1 multiplied by the dilution factor. All the CFUs are above the ideal range but still less than 200 CFU. Calculate using the smallest volume and report as an estimated value. Value CFUs on the membrane should be less than 200. If they are more than 200, they are considered too numerous to count. So when this occurs for all sample volumes, pick the membrane with the smallest sample volume and report as more than 60 and multiply with the dilution factor. For example, if you use volumes of 10, 1 and 0.1 ml and you produce the following counts. So we use the smallest volume, which is this, and then calculate the estimated result. So 60 divided by 0.1 times 100. So it is more than 60,000 CFU per 100 ml estimated count. If growth covers most of the entire filtration area, you can report as confluent growth, either with or without the specific bacteria. So if you are looking for coliform and you see coliform, but then most of the other growths cover the entire filtration area, you can report confluent growth with coliform. So probably if this occurs, you will have to request another sample or repeat the test. If all the CFUs are above and below the ideal range, you pick the one nearest to the range with preference to the one with the higher sample volume and report as an estimate. Outside the ideal range, most of the time you will have to report as an estimated value, except for when the sample size is 100 ml, and then you can report that as a true value.